Just how recriminalization is going to impact what's happening on the ground is a question many are asking. James Harries Sr. is an outreach worker with the All Nations Outreach Society in Vancouver. I spoke to him earlier about what he's seen and his thoughts on decriminalization so far. James Harries Sr., thank you so much for taking the time to speak with me.
Thank you for having me.
You are right in the middle of this issue. You're seeing it every day, and I wonder if you can give me a sense of what the past year has been like since this pilot program began.
To be honest, I don't see any value in it. These kids have to go to school and they have to pass this every day, 2-3 times a day, and it's not fair to them. It's not fair, and even in the outskirts of downtown East Side, I mentioned yesterday I was doing my round, and these two young kids just got out of school, had somebody had just taken a hit of the drug of choice, and just went face down to the sidewalk, and they walk around them and carried on with their day. It's kind of like it's normalized now, and that's not healthy.
Do you think that it's gotten worse? Like, the idea was to try and, as you said, destigmatize drug use and get people out of the shadows so that they could get helped. But the use of drugs in public spaces, has that made the situation better or worse from what you've seen?
Oh, it's definitely worse. It's right in from Astoria Hotel all the way to Canby to Kiefer to the waterfront. It's everywhere. You see it everywhere down here, and even as I mentioned, it's even up on even the outskirts of the downtown East Side. It's everywhere. As when the high wears out, doesn't matter where they are. They'll whether there's a family walking by, elders walking by, they'll stop and take a hit, and and the thing is, it's what's this track drug that's in it. The other poison that's in the poison, is it puts them into the zombie state, and then next the body's in 3 different directions, or they're flat out or on the ground or face down on the ground, and our elders and our kids have to see that.
So the fact that it will now be, again, illegal to do drugs in public, what change will that have? How will that affect the work that you do, which is trying to help people who have drug problems on the streets?
I don't think it'll affect too much on what we do, on our daily rounds that we do. A lot of what we've done in the wintertime when we had the cold spells is that when we do our rounds and walk up and down Main and Hastings and in the alleys, we see somebody freezing or cold and underdressed, that we'd take them to the Warble Center and introduce them and get them situated there, just to get them out of the cold, get them out of the elements, and get some warm clothing, get some hot coffee, whatever it be. And I kind of think that we may be probably doing the same thing as bringing them to the safe places.
What do you need more of? BC and also announced more treatment beds and more recovery centers. But what would make the difference for you, do you think, as someone who's down there and sees it all? What would make the difference, James?
Well, more feet on the ground. We've expanded. We're slowly expanding our society here. We got 4 employees now. 2 of us are on the ground, and the other 2 are administrative, trying to bring us more money in. Hopefully that we can hire more boots on the ground, because although it's like a very concentrated area, but it's a lot of ground to cover. And I've always mentioned this outreach program that we have. We go into their comfort zone, whether it's in the alley, the doorway, Main and Hastings, or in our First Nation communities into their homes. It would, or there are those trap houses or those party houses, and you knock on that door, you pick them up to the alley, you say, "Come on, let's go for coffee." And I feel that one-on-one, that going into the comfort zone, let them know that they're not alone, given that friendly face, it goes a long way. I believe it's a missing link to our people feeling is that exactly that one-on-one, and that not meeting that person in addiction or mental health where they're at, and gaining that trust, and hopefully guiding them out of it.
Yeah. James Harry Sr., thank you for speaking with me, and thanks for the work that you do there with the All Nations Outreach Society. Thank you so much.
Thanks for having me.